Welcome to an HMC HealthWorks podcast. I'm Vicki Putnam, and today we are joined by Dr. Chris Valerian, who's the National Medical Director and Program Consultant for HMC HealthWorks. Dr. Valerian went to New York College of Osteopathic Medicine, and he did his post-grad work in family medicine at Duke University. So, Chris, thank you for joining us today.
My pleasure, Vicki.
I wanted to talk to you today because June is Men's Health Awareness Month, and men die approximately 5 years younger than women and die at higher rates from heart disease, cancer, unintentional injuries, stroke, lung disease, diabetes, pneumonia, suicide, kidney disease, and Alzheimer's disease. And that, I know that sounded like a long list, but all of that is true, and it impacts their ability to, be involved fathers and supportive partners, and also be engaged in their communities. And so what I wanted to talk to you today is many of these diseases can be prevented, and there are steps men can take to avoid them, just by knowing the symptoms and having regular checkups by their healthcare provider. So I was wondering if you could talk to me about that, because I know the last time we talked was we were in the thick of the COVID pandemic, and we were talking about that, and I know that because of the pandemic, a lot of people got behind in their appointments due to COVID. So I wanted to have you talk to us about what men should do to make the most out of their appointments, and also about your thoughts on them getting back and getting caught up in those appointments.
Sure, Vicki. Yeah, and you're right. That is quite a list that you that you rattled off there, but it is absolutely 100% true as well. And some of it is genetic. It has to do with hormone balance and whatnot in men versus women. However, like you mentioned, the vast majority of the diseases, especially the chronic diseases on the list that you mentioned, are preventable with regular health checkups and with men being aware of their health status. And then, as you mentioned, the pandemic has certainly thrown all of us for quite a loop. And now that we're kind of at the tail end of it and coming out of it, there's actually been a lot of data to support the idea that people have not been going for their preventive service exams and their screenings over the last 12 to 18 months. And there's obvious reasons for that, safety and risk and, others. So there's been a lot of public service messages recently you may have seen on the news or on the TV or even here on the radio that, it's okay to start getting your screenings again, that, go to your doctor, go to your healthcare provider and start to get your routine screenings that you may have been putting off for the last year because of the pandemic, that it's time to get back on board with that.
Yeah, that makes sense. I have heard that in public service announcements, so that's good that people are getting the information on all sides. So one thing I wanted to ask you about is tell me, what can men do to make the most out of their appointments once they make them with their providers?
Sure. So, obviously, first step is make your appointment, make the call or go online through your portal and sign up. Taking the first step is the hardest one, right? But after that, you do want to be prepared and you do want to make the most of your time, as you mentioned. So, some of the things you should do would be, review your family history. If you're not familiar with your relatives' health history, then ask some questions and find out, what have people died of, what are people taking medications for, et cetera. Important. Find out what screenings you think you may be due for, or even what vaccines you may be due for. Especially with today's day and age, you want to keep up on all your vaccines, not just the COVID vaccine, which, by the way, everybody should be getting. And just put a pitch in for that.
Yes, good point.
Yeah. And then, if you're like me, I need to write things down. So, bring your list with you, right? Make a list. Make a list of your health history, make a list of any of the issues that you may be having, and bring that with you. I can tell you as a practicing provider, people that come in prepared for the visit, I have a much better experience than me fishing, right? So if I have to go digging and asking a million questions, it's a lot less productive than when you come in and say, hey, I had these 5 things I wanted to talk about today, So that's important. And then finally, if review any symptoms that you may be having, or if you already have a chronic make sure you're doing with that. If your blood sugar's been, what's your latest hemoglobin A1C? If you have COPD, how have you been doing with your medications? Have you had any breathing episodes? Things like that. So, again, sort of really take a few minutes just to think through it and don't just make it a passive experience.
Yeah, that makes sense. I know that anytime I've been prepared when I go to my physician, when I come out, I know that the outcomes were better. I walked away with clear action steps.
Sure.
The other thing I wanted to ask you about is, I had mentioned earlier that statistically men don't typically live as long as women, and I wanted to know if you could talk to us a little bit about what some of those factors are that might contribute to that.
Sure, absolutely. So, as I mentioned, some of it is genetic, and women, because of higher levels of estrogen, all else being equal, will have longer lifespans than men just genetically. However, that doesn't mean that we can't level the playing field a little bit, from our habits and our perspective. So one of the biggest things is smoking. So men tend to smoke more than women, and so that contributes to some of the statistics that you had mentioned. Alcohol is another. So again, excessive alcohol use in men is more prevalent than women, so that's another contributing factor. And I hate to admit this, but my fellow men tend to make more risky choices or unhealthy choices than women. Women, yeah. I mean, again, I put myself in some of that same category. Women tend to be more likely to go to the doctor than a man as well. So, a lot of times you'll have the female of the house will actually make the appointment for the man and kind of, coerce them into going. So men are just not making those decisions on their own. And then, I think men are more reluctant to admit they may have an issue, whether it's related to mental health issue or sleeping issues or chronic disease or symptoms they may be having. We just historically kind of bury it a little more deeply than women tend to do. So I think if you take all of those factors in aggregate, that's what drives a lot of these statistics around women living longer than men.
Yeah, that makes sense, and I like that you brought up about women sometimes giving men the nudge to do the appointments. And even though this is Men's Health Month, I also think that it's Women's Health Month so that they can support the men in their life and give them the nudge and just acknowledge those things and that you're doing it out of love. So that's what's really important. The other thing is, we were talking about in the beginning about, for me, like the biggest ones for, changes possibly in your lifestyle that can help with these particular diseases. How could men lower their risk for type 2 diabetes, heart disease, and cancer? Are there some small steps they can take that will result in some bigger changes so it doesn't seem so overwhelming to make those changes?
Sure, absolutely, and you kind of hit the big three for men right off the bat there: diabetes, heart disease, and cancer. Those are certainly the leading causes of illness and death in men. So anything you can do to sort of start down a healthier road would be helpful. So some simple things you can do. If you smoke, you want to stop smoking, right? That's pretty obvious. And even if you do smoke, cut back a little bit. If you're a pack a day, try to get down to half a pack. And then maybe take a walk. You don't have to, run a marathon day one, but maybe, instead of watching that sitcom, maybe take a half-hour walk with your loved one or your family or friend or whatever. And then, that's one thing. As far as diet goes, again, you're not going to go from eating, Big Macs to salads in day one, but maybe instead of a fast food, you could substitute a homemade meal. There's a lot of data to support that people that eat at home actually have healthier lifestyles than people that eat out. So think about that, and maybe do substitute a healthier choice if you are out. Instead of the fries, you may have fruit or a salad instead. Those are some sort of easy, simple things. And then probably the biggest one, and we all struggle with this, is to not drink your calories. I don't know if you've ever heard that statement before, but so soft drinks and sodas, juices even have a lot of calories and a lot of sugar. So substitute either, a diet drink or even water. All of us, most of us as Americans don't drink enough water a day. You should actually be striving for a gallon of water a day, if you can believe it. I know I struggle with that, and I'm sure most of us do as well, but that is the recommendation.
Those are really great tips. And in terms of the hydration and water, I did fill a gallon jug just to see one day, because I had read that and had also been told that by my primary care provider. And I have to say, even though it seems like a lot, when I spread it out through the day and into the evening, I did feel much better the next day,
Yeah.
subsequent days where I was doing it. I mean, it made it easier to do when I realized how much better I felt. So
absolutely. And real quick story on something like that. My brother-in-law actually. Yeah, my brother-in-law has a water bottle that has markings on it that basically are motivational messages for how much water to drink for a day. And if you fill it if you fill it 3 times, I think it's a gallon a day. I'm not promoting one product over another, but there may be some creative motivational things out there if you do some Google searching.
Wow, that's a great idea.
Yeah.
The other thing I wanted to ask you about too, which is not just a problem with men, it's throughout our whole society, is that the health consequences of being overweight. I mean, we just know from the 50s to now, people are carrying a lot more weight, and that, carrying extra fat can lead to some more serious health consequences. So talk to me about carrying the extra weight, and what are the types of things that can cause you to not be well from carrying that extra weight.
Sure, absolutely. And, it is, as you mentioned, being overweight is actually an epidemic in this country right now, and there's studies that show that about 2/3 of Americans are overweight, what's considered medically overweight, which is, obviously of epidemic proportions. And again, several recent studies that have shown it's not, BMI is the measure that a lot of people use, and you'll see that everywhere. Your doctor will probably talk about it. You can buy a scale that helps you measure your BMI. BMI alone is not that great an indicator. It's certainly one of the tools, but it tends to underestimate the obesity factor. What we found is a better measure, a simple measure, is waist size, waist circumference. So just get a tape measure and measure your waist. And in men, it's been found that men that have a waist size of 36 inches or less are 50% more likely to be healthy later on in life. The other way to look at that is if you have over a 36-inch waist as a man, you are 50% more likely to have a chronic health condition in the next 10 years. I know we're on men here, but just the number for women, by the way, is 32 inches. So a waist size of 32 inches or less is what you strive for from a health perspective and a health risk perspective. Having said that, though, once you determine are you overweight or are you not overweight, obviously being overweight, even moderately overweight, can lead to cardiovascular disease, specifically heart disease and stroke, type 2 diabetes, and even some cancers are more prevalent in obesity. And the reason for that really is visceral fat. We all kind of, as we age, we get that sort of little extra around the middle, and that little extra around the middle is called visceral fat, and that is the unhealthy fat, and that is what kind of leads to a lot of these chronic health conditions.
Yeah, and it's interesting, going back to what we were just talking about a few minutes before this, about just some small changes where you were talking about swapping out like a salad for fries, or taking a walk. I know with my own husband, who's actually in very good health, and he was fairly healthy when I first met him, but definitely much healthier now. And a lot of it was doing a great job of starting to keep up with his doctor's appointments, doing walks, and also like he'll take the stairs instead of taking an elevator, just those small things. And that really helped him just lose some weight and put him at a really ideal weight just from those small changes. So just from losing 10 or 15 pounds, his health just skyrocketed. And he did it, over several years. So it's not like an instant thing. So I'm glad that you mentioned that losing that little bit of weight can really make a difference and change somebody's waist circumference. The last thing I'd like to close out with is, I know one thing that we always hear from doctors, and we see it in medical newsletters and hear a lot about it, is prostate cancer in men. And so, one, I wanted to ask you if you could briefly tell us a little bit about prostate cancer, maybe what some of the symptoms are, and if there's a certain age that men start getting checked, and just give us a background on that, because I think, we all hear about it, but we don't really know all the ins and outs of it.
Sure, absolutely. And so prostate cancer is the most common male cancer. It's people think of it as the sort of breast cancer equivalent in men, right? So everybody talks about breast cancer in women, and in men, it's sort of prostate cancer. The prevalence of prostate cancer really starts to show at age 50 and above. They say if you live long enough, if you can live, a male that lives over 100 has over 90% chance of having prostate cancer at that age, believe it or not. So it's definitely something that you should be aware of and be checked for. One of the easiest ways to be checked for it is, again, like we've been talking about, is keeping your regular doctor's visits, annual doctor's visits, because there's blood tests that can be done, as well as physical exam findings that can help detect early prostate cancer. The good news is on prostate cancer is if you detect it early, it is many times curable. So it is something that you really can prevent if you're vigilant about it and take the appropriate actions. So what is it? What should you be concerned about from a symptom perspective? It's pretty nonspecific. There's several things that can mimic it, but the general symptoms to look out for are the need to urinate frequently, especially if you have to get up at night more than previously. So as we age, the prostate tends to grow anyway, which many men as they age tend to get up. If they were not getting up at all in the middle of the night, they tend to get up once. But if you find yourself getting up 2 or 3 or 4 times at night, that's something to take note about. Difficulty in starting to urinate or stopping, at the end, sort of dribbling as they call it. So if those are symptoms that are new onset, that's something to definitely see your doctor about. If you notice that the stream of the urine is weakened or interrupted, that would be something else to keep in mind. Of course, if there's any pain or burning with urination, that's not normal. Any erectile or ejaculatory issues may be related to prostate cancer and should be evaluated by a physician as well. What else? Certainly, if you see any blood in the urine, that's something that should be evaluated. There's many things that could cause that, but prostate cancer is one of them. And then, sort of non-specifically, if there's stiffness or pain in the lower back or hips, that is new onset and just sort of out of the ordinary, not the usual aches and pains that we all get through life. Those are some other reasons that you'd want to speak to your healthcare provider.
And that makes sense. I'm glad that you just said, not normal aches and pains, because it sounds like that pretty much not just, with looking out for your health with prostate cancer, but men just should pay attention that if anything feels out of the ordinary, it's different than it used to, go see the doctor, even if it's not in the cycle of your regular physical or your screenings. Would you say
Absolutely.
that?
Absolutely.
Okay.
Yep.
Yeah, I was thinking that because I know a lot of times people think, oh, I'll wait till my physical, but really it's better just to address something right away. Also, in talking about prostate cancer, can prostate cancer be prevented? Can men prevent it?
So it's not 100% preventable, but early detection, as I mentioned, is the way to go because it can be cured if it's detected early on. So again, just another reason that you should be going to your healthcare provider on an annual basis. And screening for prostate cancer for most men starts at age 50. By most recommendations, there are some situations if you have a family history of prostate cancer, for example, or a close relative has prostate cancer. There's reasons to start screening earlier than that. But again, you should talk to your healthcare provider about that, or men should talk to their healthcare provider about that. In general, though, starting at age 50, men should start to be screened.
Yeah, that's good to know. I want to ask you one other question before we close out, because we recently also had a colon cancer awareness month a couple months back, and I wanted to ask you about, I know that's a pretty severe cancer, and if it's not caught early, it can be very, very fatal. And I was wondering, what would you say for most men, what would be the age to ask their primary care doctor about that screening, or are there different factors that affect when someone should be screened, like their age? I mean, is it different depending on your background, or how does that work?
Yep. So, again, age 50 seems to be that magic age where we start to fall apart.
Us lucky older adults.
Yeah, and I'm just there myself. So age 50 is the average age for colon cancer screening in men as well. And there are several ways to do it. You should talk to your physician or healthcare provider about what they recommend. The most common one is a colonoscopy, which is that where you drink that dreaded stuff the night before and sort of clean you out, and then you get a light that looks into the colon. Direct visualization is what it's called. That is sort of the gold standard, but there are some newer other technologies that are available as well. So again, that's up to you or the man to talk to his healthcare provider about. There are circumstances, though, where you want to screen before age 50, just like I had mentioned in prostate cancer. So if there's a family history of prostate cancer, you may want to start earlier, and there's not 100% agreement on what age is the right age to start. Some of the data will show age 40, some will say even earlier than that. Certain ethnic groups are at higher risk as well and should start earlier as well. And again, I would speak to your healthcare provider, because there's not 100% agreement on exactly what age it is. So depending on your individual circumstance, they may recommend earlier than age 50 for that as well.
Yeah, and that makes sense because they're going to know you better, because they've been seeing you for years. Hopefully they've been seeing you for years, and if they haven't been, get in with those appointments. Dr. Valerian, thank you so much for joining us today, and we really appreciate it, and hope that you'll come back and talk with us again soon.
Absolutely. It's my pleasure. Anytime.
I'd like to also remind our listeners, stay tuned for upcoming HMC HealthWorks podcast, and go to www.hmchealthworks.com. Stay healthy and happy.